And we're recording. And I'm delighted to have back on the show Tucker Goodrich, who's a Wall Street risk specialist and tech guru. Welcome back, Tucker.
You'd be back. Wish we were talking under better circumstances.
Yeah, me too. So you're a friend of the show. You've been on twice before, and I wanted to get you on again because your job roughly is analyzing and creating complex systems to minimize risk, fix failure, right? And you've been quite
Yep.
outspoken through the COVID-19 coronavirus emerging. So maybe you can talk us through your understanding and thoughts on coronavirus since the time you first heard about it in China until now. Just take your time.
Yeah. One of my jobs professionally was disaster preparation, which included, I did all the disaster planning for our company. We had 12 offices around the world, and so we would watch every hurricane that came around because that's a huge risk here in the New York area. And then I also went through 9/11 here in New York, and SARS, which luckily wound up being kind of a what is it? The word damp squib, right? Didn't really fire off, but caused a lot of meetings. How are we going to handle this if this comes around? So I've been thinking about these things for a long time. My initial reaction to this was, I think, what most people's initial reaction to this, based on the last two well-known coronaviruses to come out of China and the Middle East, the SARS-1 and then the MERS, the Middle East Respiratory Syndrome viruses never really amounted to much. SARS kind of fizzled out. And MERS also, while it's still around, people occasionally get it from camels, also kind of fizzled out. So I think the expectation from everybody was that this also was going to fizzle out. I mean, that was the CDC's initial reaction. Obviously, as time has gone by, we've all realized that it's far more infectious than either SARS-1 or MERS were. And it appears to be a really effective at transmitting through aerosols, right? Droplets, they call them. They're big droplets and little droplets. The little droplets are the ones that, when you sneeze, float around in the room and can infect everybody in the room. There are some pretty interesting cases, including one not too far from here, where somebody came back from Europe and went to a party and, wound up infecting most of the people in the room. Then they started doing some case tracing on that, and one of the people who was there then went to a conference with 460 people. So all of a sudden they're like, okay, we can't trace this anymore. It's just overwhelmed the capacity to trace it. So it's certainly, it's far worse than everybody was expecting it to be. The question then comes to, relative to other diseases that have gone around in the past, how infectious is it, right? It seems to be up there with, time will tell exactly. We don't know what they're doing right now for testing is just testing for active cases of having the virus, right? They don't currently have a test that's widespread to test if you had the virus, which is what I would like to have at the moment, because I personally think that I was exposed back in late January and came down with all the symptoms and was knocked out for 3 or 4 days with a flu. And I would really like to know that, I was exposed and got over it and am now, immune to it, at least for the short term. I am sitting here in a room currently under quarantine with my girlfriend, who is a nurse, who was exposed through her workplace, where there are now, I'm not going to name the hospital obviously, but there are now 14 of her colleagues in her department on furlough because of potential exposure. She's got some of the symptoms, the dry cough and the shortness of breath. She hasn't had a fever yet, and the tests came back negative. The test came back negative. So, but they won't let her go back in the hospital because she's symptomatic. So go figure. So it'd be really cool for me to know right now that I'm immune to it. Because, even if I haven't gotten it yet, I'm probably going to be getting it in the near future when she goes back to work. Because she's, the department that she was working in was an elective surgery department, which has been shut down. So she's going to go back to doing what she was doing the day before she was furloughed, which was COVID-19 triage in the emergency room. So anyway, you hear a lot. So my immediate reaction when I hear anything like this is to start thinking about what's the risk, right? The initial estimates I've heard out of China were, the really interesting numbers, I think, are the top line exposure numbers. I went through the Imperial College model. The text of it, I'm not sure whether or not they've released the source code for it yet, but just looking at some of their top line numbers were pretty interesting. On Wall Street, we have a saying that no tree grows to heaven, which basically means no trend continues forever, right? Exponential curves are really beloved on Wall Street because if you're Warren Buffett, who had a pretty exponential growth curve for most of his career, you wind up being the richest man in the world, which is what everybody wants. But the simple fact of the matter is,
he's the Oracle from Omaha, right?
the Oracle from Omaha, yes. He may actually not. He's one of the richest men in the world. Certainly one of the richest men in the United States. He's like for a long time he was up there with Bill Gates.
And I understand that in the last year or two he's taken a lot of his assets out into cash and gold, and I'm not sure if he's explained why he did that, but interesting that he did that.
Yeah, that'd be a whole nother podcast. He's obviously a very smart guy. But at any rate,
yeah.
So when I started hearing people saying, oh, it's going to grow exponentially, well, that's really interesting, right? Because basically, if you have an exponential growth rate that continues long enough, everybody in the world is going to get this disease. The Imperial College predicted that in 90 days, based on doubling every 5 days, that 81% of the people in the United States would have coronavirus, right, in 90 days. And that was based on an exponential growth rate of about a little under 19% a day, right? So I was really interested about that, right? Because this disease has been around since November. If it was actually following an exponential growth curve, then pretty much we wouldn't be having this conversation because everybody in the world would have it already. That's how exponential growth curves work. You get a nice flat line at the beginning, and then all of a sudden it goes straight up to the sky, right? But one of the interesting comments I heard pretty quickly was, okay, but viral epidemics don't really spread, or any epidemic, they don't spread exponentially because you can't sustain that rate of growth, right? I mean, so they tend to flatten off over time, right? You get a real quick ramp up and then and that S curve is what's called a sigmoidal curve. So I started.
Can I just ask, is it thought that it flattens naturally because people get scared and introduce precautions, or is it because a certain number of people get ill and the vectors then can't move around and infect people, or is it some other reason, or do we really not know?
It's all those things, right? I mean, first off, there may already be some level of immunity to it in the population, right? They like to call SARS a novel coronavirus, but basically, to compare to influenza, which everybody is familiar with, every year we have novel influenzas, right? They're basically the same as the other influenzas, but we get new ones every once in a while. We get one that's particularly scary, like swine flu. We don't create a new disease for every influenza that goes around. It's just the latest flu, and they give it a name that nobody ever uses, and then we have flu season every year. Well, one of the interesting things I found when I was starting to look into the risk from this is that coronavirus is the same, right? Except coronavirus doesn't have a sporty name like influenza. It's just called the common cold. So everybody on the planet's been exposed to the common cold. That's why it's called the common cold. So then when it starts getting into, okay, so the guys at the Imperial College say you're going to have an 80% prevalence rate. Well, how believable is that in 90 days, right? We have a pretty interesting case study. We have that cruise ship, the Princess Diamond, I think is what it was called, that was quarantined in Yokohama Bay in Japan. And supposedly they were following quarantine protocols on the ship. But in fact, what they were doing was an experiment in how to spread a virus as efficiently as possible amongst an enclosed population, right? So you've got a cruise ship. Anybody who's been on a cruise knows it's mostly older people on a cruise ship because they've got the disposable time and income to go sit in a floating coffin for a week or two. So they took all these old people, they locked them in their rooms, and then they had food brought to them by the staff. And it turns out the staff wasn't following any sort of quarantine protocols. There was a Japanese scientist who was actually on the ship who was an infectious disease specialist who said he was horrified to see how they weren't following any sort of quarantine protocols. And they literally had staff members who were positive for the coronavirus delivering food to people, right? So they managed to get, out of 3,700 people on the cruise ship, they managed to get 700 people infected over the course of a couple of weeks, right? But that's only 20%, right? And this is pretty much the worst case, right? So if your worst case scenario where you literally lock 3,700 people into a steel box for a couple of weeks and then try your hardest,
who are in the at-risk group,
and then you try your hardest to spread the virus around, which is effectively what they did, your max infection rate was 20%. It wasn't 80%. Now, why would that be the case? Well, it's real simple, is that coronavirus is an incredibly common pathogen in the community, right? I saw one study, so then I started looking into older coronavirus studies. Now, this is non-SARS-1, non-MERS, just the common cold studies. And it turns out that incidence, so every year we have flu season, right? Turns out flu season isn't flu season, it's influenza-like illness season, because flu is only about 20% of the pathogens that people get, of the viruses that people get during flu season. Turns out number 2 is the coronavirus. So all of us have been exposed to the coronavirus, right? The couple of studies that I've seen show that it's endemic to the entire planet. It's everywhere. Everywhere you look, you find 13 to 20% of the people with the ILIs, influenza-like illnesses, are in fact sick with some flavor of the coronavirus. My hypothesis is that coronavirus just isn't as exciting because we've never had a worldwide scary coronavirus pandemic like we did with the influenza epidemic of 1918, which killed like some ungodly number of people around the world. And if you're a PhD and people ask you what you're doing at a cocktail party and you say, oh, I study the common cold, you can imagine how quickly that conversation is going to end, right? So it's entirely plausible. So the difference, most of the difference between SARS-2, which is what the current coronavirus is formally known as, and the other coronaviruses is in the DNA, which is why it seems to be so much more infectious. But the shell, which is what triggers immunity, seems to be pretty similar. So I found another study where they actually found an outbreak of SARS-1 in a nursing home. They had a big panic attack over it, and then they realized that the test wasn't specific enough, and what they had detected was an outbreak of the common cold in the nursing home, right? So now, that's not trivial, by the way. One should point out that there was another, it may have been the same study, but there was a study over 4 years. They looked at the incidence of ILIs in a nursing home, and coronavirus had an 8% mortality rate in the nursing home. So it can be a very serious disease, just like SARS-2, if you're, you know, an older person with a compromised immune system due to comorbidities, you know, just like is true with influenza. Um, so I think the biggest problem with the way people are reacting to this disease is that they're reacting as if it's, as it's being called, a novel coronavirus, right? That's not strictly true. It's a variation, just like seasonal influenza is a variation of another influenza. And, you know, I think that's an important point to make. And the problem is there's been, unlike with influenza, where they closely monitor outbreak, the pandemic every year that occurs, which is what we call the seasonal, you know, the seasonal flu is a worldwide pandemic, which is how they can have vaccines that are worldwide. Coronavirus has never been tracked in the same way up until now. Right? The only other MERS, SARS-1 and MERS, they tracked and then they petered out. So they've never done a worldwide analysis of how prevalent coronavirus is and what the actual mortality rate is. So what they're comparing it to is a big unknown, right? There's no context to it, right? I mean, every time, you know, when you go on a journey, you know that there's a certain mortality rate associated with you getting in the car and driving down your driveway and driving along the road and getting in an airplane, right? There's this background risk. And they're not painting this disease in the context of a background risk. And yes, it may be true. It looks like it's worse than the flu, but it's not, you know, how worse than the flu? Is it, you know, is it worse enough from the flu that it justifies destroying the world economy, which is basically what they're in the course of doing. As we're on this call, the last unemployment number I heard in the United States was 3.3 million from last week. And now today it's at 6.6 million. So, you know, they're causing what could be the worst recession since the Great Depression, based on a bunch of hypotheticals. Okay, so let's get back to the IC model. So the IC model starts with this assumption that it's going to increase exponentially until 80% of the people in the United States are infected. Well, that's incredibly unlikely, right? Diseases don't reach that sort, you know, we've got this cruise ship, 20% infection rate. In Wuhan, China, they got to a 3% infection rate, you know, because of all the problems with testing that everybody's familiar with. We're not really sure of what the actual infection rate is outside of that cruise ship, but there it's probably 20%. And the mortality rate on that cruise ship was about 1%. I think out of 3,700 people, 8 people have died now, maybe nine, a couple left the ship before, you know, the resolution of their case should be known. But that's far different, you know, a 1% mortality rate is starting to get down into the neighborhood of a regular flu, right? We're starting to
Especially
look
when
more
you're in the context of a very high risk group like was on that cruise ship. So
right,
1% of
exactly.
a high risk group is
Right.
comparable to a bad flu year.
Right. And then John Ioannidis, who's the scourge of medical research and statistics, wrote a paper where he pointed out that if you project that mortality rate onto the US population, accounting for the fact that there are fewer old people and more young people in the US population than there were on that cruise ship, you start getting down into a mortality rate which is commensurate with seasonal influenza, which we do not shut down the world every year for. Some people have, you know, begged to differ with him on that point, but I haven't really seen any credible argument other than, I haven't really seen a credible rebuttal to that makes the case, makes a strong case for a much higher mortality rate. That mortality rate is, just one more point there, that mortality rate is similar to what we saw in Korea and are currently seeing in Germany and in the United States. So it's entirely possible that, you know, we may be wildly overreacting to this thing. Now, influenza is also a serious disease, right? If you look at the CDC statistics based on hospitalizations, which is more similar to what we're seeing in some of these coronavirus situations, influenza can have a mortality rate of 7% of those who are hospitalized because of it. So it's a serious disease. And it's, a serious disease that's in the neighborhood of this serious disease. I don't want to poo-poo it because, everybody who dies is a tragedy, but, one pretty quickly gets down to the question, why are we reacting to this virus so much differently from, say, the flu or polio or measles, which used to kill lots of people in the United States every year and never, 140,000 people died last year in the world because of the measles, which is far more infectious than this disease is. So why didn't we close down the world because of that?
Yeah, I think this, to me, there's so many interesting things happening at the moment, and so many interesting discussions about different facets of the science and the data. And like you point out, it's all still emerging. Good quality data is still emerging from around the world. But to me, you just hit on the main point, which is it's a question of where the focus lies. And people are now focusing on this variation of coronavirus in a way that I'm not sure I remember any focus happening on any scientific matter, let alone disease. The only time I've seen this level of public focus is on elections. And we know that election cycles aren't particularly data driven. So it'd be good it'd be good to talk about what you think the hopes are for good data being used in a productive way in the next few months, and also the ultimate question, which is on everyone's lips at the moment and which is being heavily politicized, is, there's this dichotomy being set up saying either we shut down and save the lives or reopen and willfully kill people. And obviously you're saying that that's a false dichotomy, and I tend to agree, but maybe we could go
Well,
more into that.
It's worse than a false dichotomy. It's a fundamentally dishonest claim, right? Look, one of the biggest killers in the United States are automobiles. Do we get rid of automobiles because of that? No. In Wall Street, there's an understanding that every day when you wake up, say you own a stock, every day you wake up, you make a decision whether to buy or sell that stock. Even if you do nothing, you are making a decision to buy that stock because you continue to own it, right? So every day we decide to keep automobiles on the road. And therefore we own a decision to kill people in cars, right? We could lock down automobiles tomorrow and save tens of thousands of lives every year in the United States. Same thing with alcohol, right? Same thing with smoking, which we are trying to get rid of, but we haven't outlawed it. So same thing with influenza. Every year we have an influenza epidemic, and we don't adopt this standard. And the reason we don't adopt this standard is because you can't live with this level of risk aversion.
And I guess
right? The crux we are seeing.
The crux of the coronavirus messaging from different sides, and there's different doctors and scientists who I respect who have been quite vocal in favor of quite strict, harsh measures in terms of lockdowns, masks, and so on. But is your point that we should consider all the time being smarter with the measures, rather than saying lockdown is definitely a bad idea? Because I think a lot of people are saying we should do that until the data's better.
Well, but you can't do that until the data is better, right? If you go through and read, if you go through and read the Imperial College report, it's very informative, right? The first thing they're assuming is that they're making a wild assumption about pathogen growth, which I think is a ridiculous assumption, right? They're basing that to get, I think in the UK, their initial estimate was 500,000 people would die, right? Now they've downgraded that to 20,000 people. Well, 20,000 people is twice the the annual influenza number, right? That doesn't really justify locking the whole country down anymore. They're assuming that it's because of what they're doing that the mortality rate is going down. But their initial assumption is so ridiculous that you can't use, anybody who walked into your office on Wall Street and told you they had an idea that was going to grow to heaven, right, would be laughed out of the office. It's just not a credible claim. Anybody who walked in and said, oh, this is going to grow and keep going, and you're in business. If you walked into an investor's office and said Paleo Canteen is going to grow at 20% until we're at 80% of the market, he'd show you the door. He'd say you're an idiot. Nothing happens that way in the real world. Well, apparently, if you're an epidemiologist, you haven't figured that out yet, right? It's just a ridiculous claim. And it's promoting a hysteria. And a professional like that shouldn't be promoting a hysteria. I mean, if he was in Wall Street and he was making claims like that, the SEC would show up at his office and take him away in handcuffs. It's just a ridiculous claim. So the other question is it an accurate claim, right? Because we've got a couple of scenarios. We've got the cruise ship, which is the worst scenario. Then we've got, which didn't turn out to be all that bad. Then we've got what's going on in Italy and Spain, which is probably the worst scenario on the ground at the moment. And then we've got places like Korea and Germany and Japan, where they seem to have a much lower spread, right?
Taiwan as well.
In where?
Taiwan,
right. I haven't really looked at Taiwan yet. But, in Korea, they explicitly didn't do a lockdown, right? They did what I would consider the smart plan, which is not shutting their country down, but trying to track the disease down as much as possible with intensive testing, and then isolate all the people, and then follow standard flu protocols that we're all supposed to know how to do. Don't, cover your mouth, wash your hands, don't visit your grandparents, right? That's basically what the flu protocol we all follow every year boils down to, right? And that's also what the coronavirus protocol boils down to, except for this stay at home and watch the country go into the toilet part. So I got interested. I mean, when, my presumption when I see something like this is I always want to go try and figure out, does the data support the argument that's being made, right? So I went and the last couple of days, I've been looking at what happened in Italy just because I was curious. And it's interesting because, when you look at data, that's when you really learn what is the biggest problem when you're doing modeling is your basic assumptions. That's where you always get into trouble, right? And typically, in my experience in risk management, when you were trying to evaluate a model, often we wouldn't get back past the part of the discussion where we would start to ask them what all their assumptions were. And then we would realize that they had some assumption that was ridiculous, the grow to the sky assumption. And you didn't even need to look at the rest of the model because things were so ridiculous, right? So what I got curious about was looking at Italy, is it really growing exponentially? And what I found looking at the data was it was actually way worse than the IC model initially. The growth rate in Italy, so here, let me, how do I share this thing? Bear with me just a sec here.
sure.
So I'm going to switch over to Excel. This is kind of a rough draft because I haven't published this post yet. All right, can you see that?
Yep.
Okay, so this is the orange line are the total cases from the Worldometers website that everybody's been looking at.
Mm-hmm.
And if you haven't, we can, put a note in the show notes, or hopefully this post will be up long before this podcast comes out. So that's the actual data. And you can see there's a little tick down right here, it looks like, right? That tick down is on March 9th, 2020, which is when they implemented the nationwide lockdown in Italy.
Mm-hmm.
The first lockdown was 221, which just was around the Lombardy area. And the second lockdown, I think, was on like 3/7, where they locked down northern Italy.
Mm-hmm.
So I was curious, right? Okay, so they did a lockdown. What effect did it have on the data, right? On the case spread.
Mm.
It looks here like there's an effect, right? I also mapped in, just because I was curious what an exponential growth curve would look like next to it. Um, the green line is the rate of growth to get you to this point in time, right? On 3.9, this many cases, which was 9,190 cases. What sort of growth rate would you see exponentially to get you to here? And then where would it go, right? And you can see that from there it takes off. I think the last, I had to truncate the top of this because this number goes up so high, it's ridiculous, right?
Mm-hmm.
Clearly, that many people did not get infected in Italy yet. Okay, um, the blue line, I was curious to see when I started this analysis on the 27th. What's the growth rate that would get you to this point, which is about 80,000 people infected. So the green line is about 40%, and the blue line is about 28.25% per annum growth, right? The IC model uses 19%, right? 19% is almost a flat line if I put it on this graph, which is why it's not on the graph, because having a line down at the bottom that doesn't do anything didn't really make any point. So what I was really surprised to see initially looking at this was how much worse what was happening in Italy was than the worst case model in the IC report, right? But what's interesting is Italy is doing everything that they're supposed to be doing, right? Why is that? They've locked down the entire country. They've arrested, according to one of the magazine articles that I found, and I don't speak Italian, so I rely on translations. They've arrested 40,000 people for violating quarantines in Italy. There was one guy who went to get plastic surgery when he was infected with the virus. He's facing 2 years in jail. So people are saying, oh, well, it's the Italians, they're not following it. They're following it. The initial on the 21st reports, talk about empty streets in the Lombardy area and people hiding terrified in their apartments, afraid to come out for fear of getting the disease. So what's really interesting in here is happening around the 9th and before, which because of the nature of exponential or near exponential rates of growth. Now you can see down here, the green line is higher, or the orange line is higher than the green line, which means that whatever the rate of growth was in this part of the curve, it was worse than a 40% per annum or per day rate of growth. So the next thing I did was graph the data based on the growth rate per day, right? So now what that does is I've still got the same green and blue lines, right? But an exponential curve has basically two inputs. It has a starting value, which in this case we're using as 3, because it started off with 3 cases in Italy, and then a per period growth rate, which in this case is 40% per day, right? But it's the same for every period. So it's a flat line across the bottom of the graph. And what this lets us see is what was the growth rate each day in the actual cases. And you can see, you don't see it in the previous chart because it was such a small amount of people, but the initial growth rate, there was one day where it was a 425% increase in cases. Now, what does that actually mean? It means it went from 4 to 21. So 17 people showed up with, it's not a meaningful number of people getting sick. And this is why exponential growth rates like this can't continue, right? But what you see is a pretty quick drop off in the per day increase in the disease. And what's really interesting is that drop off continues all the way over to the right side of the chart. The latest number is like a 4% per day rate of increase. Now that's really interesting because now, according to the Imperial College guys, this should be a 19% growth rate, but it's not. It's a 4% growth rate, right? So And yet we're under this full lockdown, right? For the whole, pretty much the whole period, we're under this lockdown. And yet we saw these crazy rates of growth here and this steady rate of decline. There aren't any points on this curve where you can see an inflection where they put in a lockdown, right? That's what I find is fascinating. There's not, looking at this data, just looking at the growth rate, you don't see a heck of a lot of evidence for, you would expect when they lock down the whole country, you would expect to see a significant decline in the transmission rate, but you really don't see that. So the next thing I decided to go look at was,
and of course, I want to point out on that last graph that the thing that comes to my mind, apart from what you said, is that as the rate of new cases drops, you would actually expect the number of people to be coming in to get testing to be increasing. So the fact that there's
right,
a decrease in the absolute number of new cases, but probably a surge in there of the number of cases being presented, potential cases being presented, is telling.
right, right. And the other thing we'll look at next is looking at the actual death rates and making sure that there isn't some hidden, comparing the two to see, are we missing some huge number of infected people who are symptomatic, seriously ill? Because, early on in this epidemic, the only people getting tested were people who were showing up in the hospital who were quite sick. So the next thing I decided to do is add in some trend lines. And again, see, is there anything showing that there's some effect of these lockdowns, right? And it just seems to be this gradual decline in the growth of the rates, which is kind of what you would expect to see in a biological system. Because people are going to start implementing standard flu protocols. They're going to cover their mouths. That's definitely going to help cut down on transmission rate. But when I started looking into lockdown as a protocol, I found a really interesting paper from 1951 from the Journal of School Health. And the title was, Should Polio Close Schools, right? Polio is a way more serious disease than coronavirus. And most people don't remember, annually in the United States, we used to have a polio epidemic that would kill lots of people and leave lots of people paralyzed for life, like President Franklin Delano Roosevelt, who was in a wheelchair for the rest of his life because of polio. I have a friend, as it happens, who's 82 years old and was under quarantine for polio when he was a kid in school. Because one kid got polio, and how did they deal with polio back then? They didn't do mass quarantines because they found that they weren't effective. They didn't change the rate of transmission. When you looked at a town that did a mass quarantine versus a town that didn't, they didn't see a difference in the transmission of the disease. Now, why would that be? Okay, so let's think about the current quarantine that we're doing, right? People aren't going to work, most of us, unless we're in essential industries, where people aren't going to work, they're staying in their house, and they're not going outside. Well, unfortunately, from what we've seen of the transmission of this disease, the highest rates of transmission are in enclosed spaces where you're locked in with people, right? Nursing homes are seeing huge transmission rates because you've got a whole bunch of people in a closed space where nobody leaves, and then you have a couple of people come in who are infected and spread it to the entire room, right? So potentially what's happening here, and what explains this disastrously bad experience in Italy, where the lockdowns don't seem to have an effect that I can see looking at the data, is because you're changing the transmission pathway, right? Instead of whatever the normal transmission would be, say what they saw in Korea, where only the sick people were locked down, what we've done to ourselves is what the Japanese authorities did to the cruise ship. We've locked everybody in their cabin, and then everybody's going out to the supermarket where, one infected cashier could probably do a pretty good job of spreading it to a whole town, or to all the older people who are going into the town, or some sick person goes into the supermarket for a half an hour. They're going to be spreading the virus through the air to everybody else in that supermarket. It's very similar in my mind to what happened on the cruise ship, where they had infected staff who were able to spread it to 20% of the population, right? That's not an awesome plan, I don't think. In Wuhan, China, I will note, they addressed that by shutting the supermarkets, and which is even more draconian than anything that anybody's willing to do anywhere else. I don't know if anybody other than China could even manage to pull that off, because, you know, where are you going to get the vehicles to do that? Where are you going to get the staff to do that? At any rate. So the next thing, you know, I looked at the green line here is I just came up with a trend line to map to see is what, you know, what it looks like to me, really what the trend line says. And yes, indeed, there seems to be a steady decline from the initial explosion at the beginning of a very small number of people. The per day spread is just on a steady trend down to hopefully zero. The red line is just a moving average, and it's showing the same thing. And neither one of those lines is showing any sort of a kink around the nationwide lockdown. So now, why is this interesting? The orange line declining gets you to this chart here, right, which I haven't made all fancy yet. The orange line is the number of actual cases in Italy. The blue line is the projected number of cases based on the Imperial College model, right? Now here you see the power of exponential growth early on. The orange line goes up way, way, way faster because it's, you know, growing at, you know, started off at 40% per day for a few days, whereas the blue line is growing at 19% per day. You can see what a difference those growth rates make. But what happens up here around where we are now is the growth stops, right? And then this is a projection of the decline in the growth rate, and you see that it starts coming back down. This is apparently similar to what we've seen in some areas and what we saw in SARS-1, where you get this little bell curve of transmission, right? That the virus is kind of self-limiting and peters out after a while. That's typical in influenza epidemics, and it's what happened in the SARS-1 epidemic, where I'll note they didn't have testing, but it was much less infectious than SARS-2 is. So I don't know what to make of this. I'm not, you know, I know enough about models to know that anytime a model shows you something that you like, you should be really skeptical of it. Because, you know, nobody's easier to fool than yourself. The biggest problem here is this sharp point. You would expect like a 2-week flattening just because of how long the virus takes to become evident. The incubation period is 5 days median, and then another 5 days to develop serious symptoms, which might cause you to go and have a test and show up on this line. Down here just shows you, you know, the initial gains going up to 425%, and then after a while you see the gains turn into declines and the case starts to peter out. So interesting. Hopefully that's what happens. That would be very good news for all of us. The other thing that I was curious about is cases can fool you because there can be, you know, we've all heard about how poor testing is. The tests aren't perfect. There's a lot of people with mild cases who aren't tested because they never need to go in to get a test. So what I decided to do was look at deaths, which are much more concrete. And what I found really fascinating in this data is that the curves are almost the same, right? The plot, the blue line plot to get you to the death rate seen on March 9th is also 40%, a little higher than the actual cases line. The green line that gets you to the actual number of cases on March 27th is almost 29%. So what this suggests is that the relationship between the actual cases and deaths is pretty clean, and that the actual cases number is a pretty reliable number because it tracks so close to deaths. It suggests that you know, if you get serious enough to deserve to get a coronavirus test in Italy, then you have a pretty, you know, you're looking at a pretty solid number for the actual cases based on the relationship of the progression to death, which of course none of us wants to experience. I was very surprised to see that, because I was an early believer that this disease probably spread a lot faster than what we thought based on the poor testing. But looking at the data, I have to change that view to think that what we're seeing is actually, you know, we're definitely undercounting, but we may not be undercounting by orders of magnitude, which is good because it suggests the disease is probably, you know, the disease seems to be explosively contagious early on, but then it peters out pretty quickly, which is what you want to see with an epidemic. So then I did the same analysis in deaths in Italy. The black line is the death line. The green line is the 40% growth line. The blue line is the 29% growth line. And as you can see, the black line skyrockets up to 133% on 3/6. Now, again, this is, you know, the disease has to progress, so this is lagged. This is basically lagging what's going on in the actual cases. And what's interesting here is that you can see that this black line is bouncing back and forth through the green and the blue lines. This is a much higher increase than we're seeing in actual cases, deaths in this area. And it doesn't really start to flatten out until March 9th, right? So if we go to the next chart and start looking at some of the curves, basically what I think happened is that the Italian authorities looked at this, frankly, scary exponential growth rate in deaths in Italy. And when they saw that it looked pretty steady, on the 9th, they locked down the whole country, right? But again, what we see is that the trend line down, which is again going to follow the actual cases, which we've already established has a pretty good relationship to deaths. The trend line started way before they locked down, started to go down way before they started to lock down the whole country. And I was really surprised to see that, which suggests that some of the decline that we're seeing over there is just the natural course of the disease. And that's consistent with what they reported from the polio epidemics in the United States, where they said they never saw mass quarantine measures affect the course of a disease through a population, because basically what you're doing is forcing different methods of transmission, I think, right?
Especially in places like Italy or Spain, where, you know, there's papers on this that show that, you know, if you're a sort of at-risk adult in Italy or Spain, you're probably about 90% chance you saw your family in the last few days, and there's
Right.
about a quarter of a chance that you live with them. So it's not like that in the Netherlands or Germany, where you might see them half the time.
Right, right. I guess that's a point in favor for us antisocial northern types. We don't have the tight family life of the Mediterranean countries.
We don't kiss each other on the cheeks either.
Yeah, exactly. Yeah, I guess one of the things that we may see out of this is we all adopt the Japanese custom of bowing to each other, which seems to be doing quite well over there. So, you know, I was really surprised in looking at this data. I was really surprised to see how high the initial growth rates over there. I mean, explosive is the only word that you can use for this, but it's also clearly not exponential, because then it steadily declines and hopefully will start to peter out pretty soon, which, you know, then you get into the question, how effective are these lockdowns in fact? You know, given how ineffective it looks to be in Italy versus South Korea, or Japan, where they haven't done a full lockdown, it's kind of hard to make the case that, I mean, this is the worst case, and they did a pretty draconian lockdown. So why, if it's such an effective intervention, why are we seeing close to the worst case in a place that followed the protocol, right? In my view, it blows up the Imperial College model completely on their base assumptions. Base assumption, it's exponential growth. It's not. Base assumption, it's going to grow to 80% of the population. It's unlikely that that's going to happen. And they don't mention at all this like steadily declining growth rate that we see from early on in the Italian experience. So, and then here, yeah, one of the things that I did early on when I was doing this analysis is I cut out the crazy numbers, crazy high numbers, the 425% growth rate and the 133% growth rate, because those have got to be outliers. I mean, I'm assuming there's, you know, some element of a bunch of people have gotten sick and they come into the hospital all at the same time, and that may not represent a real spike in the disease. So I truncated those out, and you see, you know, the same sort of decline in the growth rate trend line around about the time they finally decided to lock down. Now, the key point about deaths and a lockdown is if you're seeing deaths decline at the same time the lockdown goes into place, the lockdown is not causing the decline in deaths, right? I think there's a real argument that that steady high rate of deaths caused the lockdown. You know, I'm sure that they were quite horrified to see that in Italy. But the disease, the course of the disease is it takes 5-day median incubation time and then another 5 days to progress to a serious disease. So let's say, you know, you should see a 10-day lag time after the lockdown is implemented before diseases or before deaths start to go down, if the lockdown is causing the decline in deaths. You don't see that in this data. It's clearly a trend that predated the lockdown protocols over there. So the next thing that I want to do once I get this post up is go take a look at the American data and see how closely it tracks what happened in Italy, because we seem to be on course to become one of, you know, the next worst case, at least in infection rates, although mortality in the, you know, mortality in some areas like New York and New Orleans is very high, and the country rate overall it's pretty low. So hopefully that'll play out and we won't be seeing these worst case scenarios. Now the other thing, you know, I did a post or a tweet a long time ago about ARDS. ARDS is acute respiratory distress syndrome. I found a neat paper after I started looking at SARS titled, "Is SARS Just ARDS?" Okay. Now, forgive me the acronym. SARS is, what is it? Severe acute respiratory syndrome, the disease that's caused by the coronavirus, SARS-2 and SARS-1. ARDS is acute respiratory distress syndrome. And the tweet was, the mechanism of ARDS appears to be omega-6 fats breaking down into toxins like HNE in your serum and in your lungs and destroying tissue. Now, I've talked before about this omega-6 death spiral that you seem to see in some disease states. ARDS was my poster child for that process because it's the only paper I found that measured it longitudinally, right? Looking at early serum and later serum and seeing a decline in the percent of linoleic acid in serum and erythrocytes and the rise in the omega-6 toxins. So that was like my poster child for what could go wrong with too much omega-6 in the diet. Well, it turns out that that's how SARS kills you, by kicking off that omega-6 death spiral. In this case, it's a literal death spiral because it will kill you. Now, before everybody goes, oh, this is, you know, hyperbole, there's another neat paper that I found the other day that looked at people on ventilators. We all know that, you know, people get put on ventilators in SARS because they go into ARDS or they're nearly at ARDS and they're trying to, their lungs are starting to break down and they have to put them in a ventilator to keep oxygen flowing. So they had done a while ago a study looking at people on ventilators who were given total parenteral nutrition, which is typically a soybean oil and glucose. And they looked at the rate of people who were on ventilators who went into acute respiratory distress syndrome. And it was like 30%. The rate for people who weren't getting the soybean oil feed, soybean oil IV infusion, was about 3 or 4%. So you're looking at a 10 times increase in the incidence of ARDS in people who are on ventilators who are put on IV nutrition. Now, the other interesting paper I found was looking at what does SARS do, and this was SARS-1, so I'm kind of making an assumption here that SARS-2, both of them can put you into ARDS if it goes wrong. So I think it's a safe assumption to assume the mechanism between the two is pretty similar. So they looked at what does SARS do to your cell, right? What are the changes that happen in your cell after you get an infection? And it turns out that what SARS does to your cell is it kicks up the metabolism of omega-6 fats. What they also looked at was what happens if we add omega-6 fats to the cell. And it turns out that it actually impairs SARS replication in the cell if you add omega-6 fats. So their hypothesis was that by kicking up the omega-6 metabolism in the cell, that the virus may be making the cell more hospitable to itself. And, you know, there's another paper that I found that looked at membrane omega-6 levels. Actually, I think George Henderson found this, to give credit where it's due. No, I'm sorry, my mistake. It wasn't George Henderson. It was Peter at the Hyperlipid blog. He found a paper that looked at the serum omega-6 fatty acid levels and found that the higher it is, the more it predisposes you to ARDS. Pretty linear relationship, if I remember correctly. So, you know, I don't know. That's a whole bunch of little dots that it's kind of hard to connect, but it definitely wouldn't make, I think that taking more seed oils to prevent SARS replication in your body might prove to be a poor idea in the short term. And I think that, as always, fixing your diet, there's never, you know, the wrong time to do it is when you're already on the ventilator. Because they have tried to do that, and cutting back on oxidative stress doesn't save you from ARDS. So
I have seen a paper that Dom D'Agostino shared where when people had to go into tube feeding on a ventilator, they did a small, I think it was 30 patients, controlled trial where half of them got a low carb, high fat feed, and half of them got a regular feed. And the low carb, high fat ones came off their ventilators, was it about 60 hours? Sooner, yeah. So it was significant. Right. A small study, but interesting nonetheless. But that data around omega-6 is fascinating. I think it's like there's a whole swirl of people kind of seeing the thing through their own lenses, and it's understandable. You know, whatever your thing is, it makes sense to kind of see how the C19 situation kind of rubs up against it. And I'm not surprised that you've found data that would support the idea that not having seed oils is a good thing for respiratory illnesses as well.
Well, I honestly kind of hate to almost bring it up because of that, but yeah, you know, the data with people on ventilators going into ARDS being 10 times as high, or nearly 10 times as high, that just blew my mind. And the fact that the virus is kicking off omega-6 metabolism, that just blew my mind. I mean, honestly, I don't know, you know, to be completely honest, if you stop eating seed oils tomorrow, and you get exposed to the virus next week, I doubt that seed oils will make any difference. And, the difference will make, the change in diet will make any difference that short term. But, it's lots of other good reasons to do it. It's just another one.
Yeah, I mean, there's been accusations flying around that people are kind of pushing their own agenda or trying to sell stuff around this time and talking about dietary advice, and particularly, doctors.
Well, when I figure out something to sell, I'll let you know. Okay.
Yeah, I mean, I don't think that could be aimed at you right now, but I think we've spoken about this before about attribution of intent. You don't know whether someone's selling it because they really care or not. So why even bring it up? But people like Asim Malhotra, he's a consultant cardiologist, and I think that he's been accused of pushing an agenda by saying that people should think about improving their metabolic health. It's never too late to do that. I mean, what if you're going to catch the coronavirus in a month or two? It's definitely worth thinking about, in my opinion, improving your metabolic health somewhat.
Oh, yeah, I saw some people criticizing him and some other folks on that. And the best response was from Dr. Tro Kalajian, who, and it's typically expletively in tweet, said, "Don't any of you idiots know that glycemic control is a major factor in pulmonary infection death, and that every ICU in the country carefully controls hyperglycemia in patients to prevent worse outcomes?" Well, heck, the best way we know to control hyperglycemia is a low-carb diet. That's like a no-brainer, right? And there's no downside to it. So yeah, if you're sick, absolutely you should be cutting back on your carbohydrates, not even getting into one of the other things. There are lots of papers showing that influenza replication is controlled by the glucose levels in the cell, and that lowering the glucose levels makes it more difficult for influenza to replicate because it's basically eating glucose, right? I looked for stuff like that with SARS and couldn't find anything. But given that coronaviruses are a major cause of serious respiratory disease, the second biggest cause after influenza every year, forget about this year, it's entirely possible that they're also limited by glucose. And, seems like a pretty safe thing to do. And, there's a pretty solid body of literature supporting it, even though most of the medical profession does their best to ignore it.
Yeah, and it'll be really interesting to see after the dust is settled what the data says about the patients that were admitted to intensive care and those who died compared to their the rate of the underlying conditions that they had, and specifically comparing that to the rate in society in general, because of course that's the comparison that you need to make to understand whether it's a risk factor for the worst outcomes of the disease. And at the moment, anecdotally, it varies. Some people say it doesn't seem to have anything to do with diabetes, and then other people say it does, but the data on that's probably not great anyway.
Yeah, it's not great. And, the diabetes diagnosis is so high that it's, so fine. So you're at 6.4 HbA1c and they say you're not diabetic. Come on, that's ridiculous. You've got, my father was at that level and they were on the verge of cutting his foot off, which is a classic diabetic side effect. So, okay, but he's quote unquote not diabetic because he's off by 0.1% on the HbA1c number. I mean, that was ridiculous. By the way, got him down to normal in 2 months on a low carb diet. So yeah, if hyperglycemia is a risk factor for pulmonary infections, then I would say a low carb diet is probably the smartest thing you could do short term. A low carb, low seed oil diet is probably the smartest thing you could do short term, without any question in my mind.
And I think from early doors, I've been quite interested in the two kind of potential therapeutics or preventatives besides lifestyle, which would be some sort of drug, most prominently hydroxychloroquine, and a vaccine. But
Yep.
a vaccine seems to be, at least 18 months or 2 years away, and potentially not even relevant, because it's like I've seen you say, it's like trying to find a vaccine for the cold, which we've not found
Well,
in
it is the
100 years.
cold. I mean, it's the common cold on steroids, but it is the common cold. And I've lived my entire life listening to how the goal of medicine is to cure the common cold, and they still haven't done it yet. And I would take the upside of that 18 months. I've read some other papers talking about how it's impossible to come up with a vaccine against SARS like some other viruses, because the virus actually uses the antibodies to replicate if they're too low. And there was a great paper that came out of the Middle East that I looked at a while ago that was looking at the various attempts to come up with a SARS-1 vaccine and all the problems that they were running into, because the virus does use, I think it's called it's ADE, antibody-dependent exacerbation of the infection. So, 18 months to do a vaccine for this, when they've been working on a vaccine for this since 2003, I think it's kind of pie in the sky,
Mm.
unfortunately.
It's just something that I really want
And I
to.
certainly don't think we should all stay in our houses until they come up with this vaccine. That's insane. And that's one of the core proposals in the Imperial College report.
Yeah, the first report that's now been, there's been a kind of something added to it, or it's been, they've talked to it since. But originally they said that this lockdown should or could last more than a year, right?
18 months.
Yeah, and the
Because,
curve in that looked absolutely terrifying. You saw the intensive care bed capacity, and it barely looked above zero compared to the number of cases requiring intensive care that they thought would be required, and that they were looking at 500,000 or so, and now they've rounded it down to potentially 20,000, which is
well, that was deaths. 20,000 was deaths.
deaths. Yeah.
500,000 was deaths originally, and they moved it down to 20,000. They claim based on the success of the lockdown intervention. Okay. Yeah, that, I don't know. I view that report as being pretty irresponsible, as we've already discussed. You shouldn't be making projections like that, laughable projections in my view, and then going and taking them out to people like who don't know any better, like politicians, and getting them to act on this, because there are a bunch of points in that report that are valid points. For instance, all these people who were locked in their houses thinking that they're not going to get coronavirus. The basic premise of that report is that there's no way to stop it, that there's no intervention we can do that can do anything but slow down the spread. That's the rationale. Flattening the curve. And I started looking at this Italian data to see, did they flatten the curve in Italy, right? And as we've already discussed, I didn't see any evidence that they did. What I see is that they're riding a trend of a flattening curve because of the disease progression. And it's just, it's, so people don't realize that what they're saying is, this is going to come back. It's so contagious, right? This is what happened in 1918. You had two spikes. You had the flu came around in the winter, just like it always does. Summer, it died down. Then the next winter came around and the flu spiked again. That's what they're expecting is going to happen with this coronavirus. So how is this a long-term plan, that we're going to lock everybody in their houses until we discover a virus or a vaccine? That's insane. But they're not being honest with people. They're not going out and saying, look, you know, if they hadn't hyped it so much early on, they could come out to people and say, okay, the death rate is reasonably similar to the flu. You need to be more careful because it is higher than the flu. And in affected people, it can be a lot more dangerous than the flu, which is, I think, what the data seems to show at this point. But, you know, we can't shut down the planet for 18 months. I mean, I've seen some even more insane, you know, it's, the Arnold Foundation had this thing they were talking about a while ago, surprise billing, right? Which is basically when you go into the hospital, say you get whacked on the head and they throw you into the hospital, you're no longer conscious, you can't do anything, and they run up all these tests and nobody ever bothered to check your insurance. And then when you wake up, you discover you've got a $200,000 bill
Well, this
that
is
they're
what I was
trying.
going to talk to you about, is how is this affecting people specifically inside the US insurance-based system? Because in the NHS, it means that, you know, Boris Johnson's, ironically, given their conservative policies, usually they're plunging 350 billion up to that into the economic stimulus. But in America, obviously people,
That's
you know,
peanuts.
yeah, are there, you
The
know,
Americans know how to spend.
if you're losing your job in America and then suddenly you've lost your insurance, right? A lot of the time,
Yep. Yep.
and
Nope. Well,
so
they
you
didn't really think about that, you know. So yeah, basically what this is a worldwide case of surprise billing. They have thrown us all in the hospital. They're not letting us make any decisions anymore, and they are going to bankrupt us. It's crazy, right? You cannot make decisions like this without taking the economic consequences into consideration any more than you would do if you went to the hospital. Because I mean, you know, unfortunately, being sick sometimes makes hard choices. I've met people who came down with cancer and realized that if they fought it, they would bankrupt their family, and said, okay, then, you know, I'm going to spend, instead of spending $300,000 fighting this to get maybe a couple extra months of life, I'm going to spend $50,000 and go tour around all the places I wanted to see before I die. Right? You got to make hard decisions when you're talking about diseases like that. It's just not credible to say we'll spend whatever it takes.
yeah, I think
It's
this is a hard discussion that's coming out of the left at the moment, where you know um, a sort of a desire to be compassionate there and saying you can't put a price on life, but actually you must, because if you don't if you don't put a price on on a therapy, on doctors' time, on nurses' time, on bed space, then and you spend 10 times the amount that you normally would, then okay, you save those lives, but you've just lost the ability to save 10 times as many lives. And it's
right,
not necessarily because you're underfunding a health service. That may be the case, but it can't be infinitely so. So you really must make these hard decisions. And it's not about left and right. It's about you
well,
know
that's
you've got a 5 year lag time on training doctors. You've got a certain number of hospitals. You can't make an infinite number of hospitals. You know, it's just impossible. So you have to draw a line.
right. I agree. And Malcolm Kendrick just did a great blog post. In your system, the NHS, that's built into the system, the NICE, the
Yes.
most Orwellian acronym ever, I will like to point out.
National Institute for
So
Clinical Excellence, as was.
yes, that's right, which was in an election we had a few cycles ago, Sarah Palin called it the death panel, the group of
Uh,
people who decide whether or not a treatment is going to be applied to a person.
yeah, that was embarrassing for someone, I can't remember, because they said that if Stephen Hawking lived in the UK, then he would be dead by now, not realizing that he was a professor in Cambridge.
Right. Yeah, exactly. Exactly. But the point is that's already built into the NHS
Yeah.
system. And as you observe, it has to be. You can't spend an infinite amount of money keeping one person alive and not have the resources to treat everybody else.
And it's not about left, right. Again, like I tend to lean left, not that it really matters, but I can just see that you just can't have an infinite number of bed places, doctors, and nurses. So you must allocate resources.
Right. And unfortunately, what we're looking at is, I saw a funny meme going around the other day, a picture of the founding fathers debating the Constitution in Philadelphia back in the late 1700s. And there was a little blurb coming out of one of their mouths that said, "None of this matters if you're sick," right? Which is basically, so all of a sudden we decided, apparently we decided to nationalize healthcare and put everyone into home arrest. And there was no election about this. I mean, they're making this momentous decision just literally off the cuff. Andrew Cuomo, the governor of New York, has already admitted that if he'd had a little more time to think about it, he wouldn't have done the lockdown. And he observed some of the things that we discussed earlier in this podcast, that you may actually be increasing the chances of the most vulnerable people who are now trapped in the house with their kids to get infected. It's a real issue. And
Yeah.
unfortunately,
And another thing that Malcolm Kendrick brought up was that it's not just about saving the lives versus spending the money. It's about the cancer patients you don't treat because you're forcing lockdown and forcing healthcare resources to be moved elsewhere.
yes.
It's about the suicides that will happen because jobs will be lost and livelihoods will be lost. It's about domestic abuse cases that will go up because people are forced to stay in their homes. These aren't theoreticals. This is definitely going to happen.
Well, in the Great Depression, in the first 2 years, I saw a paper, there were 40,000 excess suicides, right? We've now created a worse economic collapse than the Great Depression. How many people do you think every restaurant in the country is closed. These are all small business people. They don't have a lot of money. You don't get rich, unless you're McDonald's, you don't get rich running one restaurant. And these people, I don't know how they're going to get by, right? There are going to be an enormous amount of people whose livelihoods are ruined and who are out on the street. There are a lot of people. I saw somewhere that something like 50% of Americans live paycheck to paycheck. Well, 6.6 million of them aren't getting a paycheck anymore. That's a problem. They're going to run out of food soon, right? There's no plan for this. We have no, to the credit of the Chinese communists, when they shut down those areas, they had a plan to bring food in and supply everything. And, it's communist, so they can just give the food away. But even then when they started lifting the lockdowns, they were having riots over there in the streets because people wanted to get back to work, and they worked in a different district that hadn't reopened yet, and they were having pitched battles in the street. One police department with the residents against another police department, which was trying to keep the residents of the first district out. These are all real costs, and none of this was taken into consideration when the panic, and let's call it was a panic about this virus hit.
Yeah, and I guess there's a huge streak of political expediency thrown in because if you're a politician, you at this point you mustn't do anything but the most belt and braces measures, or else if
Right.
when people die, you can't look back and be accused of not having done everything you could, even if it was
Yes,
the wrong thing.
That's right. That's right. And yeah, that's right. And hopefully they just, I know in this country, at least, our politicians are reading these articles and essays that I'm reading, pointing out how much of an overreaction this is, because they're mentioning them. Like, Cuomo, I mentioned, cited this thing that was in the Times the day before, saying from what's his name, Katz, up at Yale, who amusingly enough is, on the total opposite side of the dietary thing from where we are. And yet nevertheless, he came out with this very sound, sensible editorial saying, look, we can't do this. This is just too much. We're, hopefully in the short term, and nevertheless, at the same time, Trump extended the lockdown over here till April 30th. So it'll be interesting to see what the unemployment numbers look like then.
Yeah, it's probably hard times ahead. I mean, I think I'm looking for silver linings, and I wonder. I can't remember if I mentioned it when we were recording yet, but there's been this like surge of opinion from the general public about coronavirus that we rarely see regarding any subject except maybe elections. But I said at the time, I don't think elections tend to be data driven. It would be nice if public engagement on health at this moment converts into some kind of increased engagement in the data, in the science. I mean, what do you think the hopes are of that happening?
I think that may be part of what I'm hoping is going to be a bigger phenomenon, which is people start realizing that this overly credulous trust in experts is a huge mistake, right? And the diet problem has been an aspect of that. But now that it's in front of the entire planet, that, hey, these guys are, you've lost your job, your kids are not going to be eating next week when your paycheck runs out, and you're probably going to be out on the street, that's a pretty big screw up. So yeah, I hope, that message gets around, and that as a result of that, people will start looking at the dietary guidelines, which are farcical, and start saying, well, these are the same idiot experts who, caused the great common cold panic of 2020. Aren't they doing the same thing here? So yeah, I hope that there's a great deal more skepticism about the rule of experts that we are now suffering under.
Yeah, I would like to see that too. And I think that sentiment's often misrepresented as a kind of laissez-faire attitude to knowledge, like, oh, you should just do whatever you feel like and go anti-vax or whatever. But it's not that. I like to think of it as humans being the great outsourcers. We use tools really well, and I think you should choose your guru. You don't have to understand absolutely every minutia of the details, but if you take a little bit of time to choose your guru, then at least you've thought about it that much.
Right, and everybody gets that when it comes to getting their car repaired, right? Everybody knows that if you know enough about how your car operates so you can tell when the mechanic is trying to rip you off, you're going to be better off that way. And yet that doesn't occur to people when they go to the doctor. They just blindly follow the doctor's advice. I mean, one of the things that really, I can't remember his name now, but there was a British doctor who had an excellent blog years ago. I can't remember his name now, but he had a great post where he observed that 80% of medicine is not evidence-based, right? And Gary Taubes kind of makes a joke out of that. Well, wait a minute, if it's not based on evidence, then what the hell is it based on, right? Anybody who understands how medicine is actually practiced and where stuff comes from should be horrified. What do you mean there's no evidence for this? I mean, it's crazy. And basically what we're seeing is in this coronavirus panic is the very worst parts of medicine put on display, right? This worldwide lockdown is an untested intervention on patients without their consent, right? It's the definition of unethical behavior in medicine. And some people are standing up and pointing that out, but it is literally the definition of unethical behavior. I've been, calling it killing the patient on my Twitter feed. And I think that's exactly what they're doing. They're just, Dave Feldman likes to observe that the perfect preventative for cardiovascular disease is cyanide, because it's guaranteed to lower your risk of cardiovascular disease by 100%. Well, that's basically how we're treating coronavirus, with cyanide on the world economy. It's hard to imagine a protocol that they could have pursued that would be worse for people than what they're currently doing. I mean, the Koreans did a better job of everybody else and didn't need the lockdown. So why are we doing it? It's crazy.
Yeah, I think those you would just need one black swan as always, but you have several where there is no lockdown and actually they are doing well.
Yes. Yes. And I mean, there are lots of reasons, you know, without getting into European stereotypes, the fact that the Germans are doing so much better than the Italians apparently shouldn't surprise anybody, but it's a real question as to why they're doing better than the Italians. You know, there's not an obvious answer to that. But
Besides the family contact link,
yeah,
perhaps.
I mean, but that's plausible, but it's hard to say, it's hard to say that that's actually what's going on. I mean, Italy certainly has apparently the oldest population in Europe.
A
They
lot of
have a lot
smokers.
more, huh?
A lot of smokers.
Right. And they
Nicotine.
also, every year they have a lot more people dying of the flu than the rest of Europe does. So this is not what's happening with coronavirus it's not surprising that Italy's having the experience that it's having. That's the experience that it has every year with influenza-like illnesses, which SARS-2 is one of. So I don't know.
So
Keep your
what's
fingers
your
crossed
what's your
that
big
things
hope for the next month or 6 weeks?
that we come out of this panic and realize that this lockdown has been a huge mistake and that this can't continue for 18 months. I mean, I can't believe that it's gone as far as it has gone. When Italy locked the whole country down, I was like, oh, well, that's Italy. We'll never do that here. Now they're closing down. Did I mention this before? Now they're closing down outhouses out in the middle of the wilderness here to prevent the spread of coronavirus, which I think is a huge demonstration of how many people are using this. There are lots of people who really love bossing other people around. And, you know, every one of us has encountered a policeman or a bureaucrat and thought to ourselves, well, obviously the only reason they're doing this is because they want their little piece of power. Well, those people are having the time of their life right now. They are having the time of their life because they are now running the world. And it's not a good thing.
Yeah, well, fingers crossed that the rates keep dropping and that calm heads prevail. It was really good talking to you about it. I hope that in the next few days and weeks it starts to ease off and we can look back on it as a kind of brief bad dream.
Yes, I think that's the best thing we can hope for right at the moment. Thanks for having me on, Natalie. It was great talking to you.
All right, Tucker, and I'll put, as usual, all your the places that people can find you, your blog, and your Twitter handle.
That's great. Thanks, sir.
All right,
Have
thank
a
you.
great day.